on my way in to do some training others. And that's actually one of the tenets of our profession is training or teaching, education. We're expected to educate, whether it's patients or each other or others, non-nurses. That is actually one of our basic responsibilities. It's one of our really a big thing that is being pushed, I think, in recent decades. I'm old enough to look back, and although I wasn't in the healthcare field at the time, I knew nurses, dated nurses. So it's evolved a bit. So nowadays, it's a big thing. They're always talking about education. So I'm doing my part just because it's kind of required as part of our annual competencies, and it's actually kind of volunteer work. They asked me to do it. So it's part of like it's an organizational thing that I'm just like, okay, I'll do it, no problem. Yeah. But you can do education and not deal with patients really in direct case. I mean, you might have to do some patient care just to get your cut your teeth on it. It is not required. I've heard cases where people go straight into education, get their MSNs and whatever, and bypass a lot of that. I don't recommend it. In my opinion, you're a little out of touch. It's good to have those skill sets, especially if you're teaching. You'll find this in nursing school that you learn best, in my opinion, most people do, by actually doing. You get your hands on field stripping, whatever. It's like get your hands on, like cooking, or driving. You're really learning from the instruction side or the book side. No, you're actually learning by doing. So that's the best way to really integrate those skills into you, because you're going to have to do it as a nurse, bedside nurse, or whatever, acute care, whatever, or you're going to teach it best to, because you're going to have to demonstrate. One of the basic methods that is universal is teach back. So you're teaching the actual movements, process, procedures, and you want to see them demonstrate it back. If you do it wrong, they're going to do it wrong. It's like children. They're going to imitate you, and you do it wrong. So today I have to teach by doing, and see how they do come back. And I'm going to see if my skills are rusty or not. So it is what it is. So I'll be training a whole group, a whole new cohort. So I don't know. Like, what? Who taught you that? Ray did. I was like, oh crap. So, I've done a number of videos, and like I said, I think the number's now up to 80, and I posted videos. It's just that I can't keep up with the backlog, and I have to reshoot a number of videos. I just remember, this is a reshoot, because I realized my AC was on. In the summertime now, it's hot, and I have to run it. Thankfully, I'm up, relatively early. It's not even 6:30 yet, so it's still not really crazy. It's going to go up to 100, they say today, and hopefully this will be the last hurrah for summer. I love summer, but I don't like hot summer. I prefer spring and fall, more temperate. I think that's why I'm an Anglophile. I like the temperate weather of England. I liked it when I visited there. That was very nice. It was a nice trip. I took my girlfriend back in the day. So, it's one of the many professions or subsets that I had shot videos on, and I mentioned it really quick in the other video. Here I'm going a little more in depth, and I'm going to cut it off because I'm close to work and I just want to get ready. But education, whether it's in an acute setting or in a academic setting, is a big thing. Every patient you're going to have, you're going to go into bedside or patient care, it's also something you're expected to do. You're supposed to educate every patient on whatever they have. It's diabetes. Hey, you're newly diabetic. Congratulations. We're going to teach you about it. How you have to, take care of your insulin, blood sugar. Oh, you've got CHF. You've got heart disease, whatever. You've got COPD. You've got obesity. You got to teach them how to deal with that. 90% of the time they're like, shut up. That's fine. But there's 10% of the time that the patient really is interested, they're curious, they're worried. This is their health. It's like, I don't want to die. I just had a stroke. What am I supposed to do? Or if it's not the patient, it's the family. Oh my God, my mom has dementia. How are we supposed to deal with that? Oh, my husband just had a stroke. How am I supposed to take care of him? Oh, my children, my child has diabetes, type 1. How am I supposed to take care of him or her? These are issues. Guess who does the educating? 90% of the educating. Yeah, there's going to be 10% taught by the doctor. Guess who's got to reinforce that and really pound that in? The nurse. We actually have a dedicated diabetes educator, nurse, MSN qualified. Yeah, I think she's MSN. I'm sure the head of the program is. I'm sure there's a cadre of nurses that are just just RNs that under her that are teaching the rest of it, doing the field work. But again, this is something that is over and over is part of your patient care. It's part of your responsibility as the nurse. So, just FYI, this is a subset of the profession that you can get into that has nothing to do with patient care. Because I hear, that's probably what I hear the most is, I don't want to deal with patients really. I don't like people. No nurse likes people. After a while, everybody hates people. But you still care for them, You can not tolerate your kids or your significant other, but you still care for them. You still take care of them, You love them dearly. That's fine. You don't have to love your patients dearly, but you can. It's easy, That's the analogy I'm using. It's like you can still not get along with people and still take care of them, not wish them ill will. So it is something that you can still do in the profession that has nothing to do with direct care. Because a lot of people say, hey, I can't deal with people. And I said, fine, just deal with them for short snippets. Teach them, or teach the nurses that have to take care of them. You don't have to be whatever. If you don't like dealing with even nurses, then I don't know. Maybe telemedicine. Even then, you're dealing through a medium. I don't know. Write books then. You could always do research. There's a lot of research. Again, education, but totally removed. But typically, you still have to teach. You have to put out papers. I have a whole family of academics. They put out a lot of papers and to get their jobs, to get tenure or your PhD, you got to put out. My family's all full of them. You got to put them out. You got to do that. I'm not that rude. I'm the grunt. All right. Good luck.